My name is Greg Uniton, and I'm a medical malpractice attorney. I'd like to talk with you today about potential cases involving a heart attack and what we need to know to evaluate such a case. Typically, these cases start with a patient who has chest pain, and they present either to a doctor's office, an urgent care clinic, or an emergency department with not only complaints of chest pain, but usually other complaints as well, such as pain that goes into the arm, nausea, sweating, or shortness of breath. We need to know what was reported, which symptoms were reported to the doctor or the hospital. In addition, we'll want to know the patient's past medical history to determine whether there were certain cardiac risk factors that made it more likely the chest pain was associated with a heart attack. Some of the most important risk factors include diabetes, high blood pressure or hypertension, and high cholesterol. We'll also want to know whether the patient has a history of smoking, their age, and whether there is a family history of heart issues. Once we know the symptoms and the past medical history, we'll next want to know what type of testing, if any, was performed by the doctor or the emergency department. Usually in the case of a doctor's office, when there's any suspicion of a heart attack, the best course of treatment is referral to the emergency department. But once the patient gets to the emergency department, the question then becomes, was a troponin test performed? Was an EKG test performed? The troponin test is a test that measures a certain protein in the blood that, if elevated, could mean the patient's having a heart attack. And an EKG measures electrical abnormalities in the heart, which are often present in the setting of a heart attack. After we have the answers to these questions about what was reported in the testing that was performed in the healthcare setting, we need to know the outcome. Did the patient get discharged to home? Or was the patient admitted for workup by a cardiologist? And did that patient lose their life? In a situation where a patient has lost their life because of the delayed diagnosis of a heart attack, and we find that a doctor or a hospital made a mistake, often a lawsuit will be warranted. Fortunately, however, some patients do survive, and they go on and they're further evaluated by a cardiologist weeks or months down the line. And we would need to know whether that cardiologist ordered an echocardiogram and whether or not an ejection fraction was reported for the patient's heart function. And that could tell us whether the patient is at risk of serious permanent heart damage or even congestive heart failure. I hope I've answered some of the questions that you might have about a potential case involving a heart attack. Please remember, we review cases for free, and we also obtain medical records on your behalf. So if you have any doubts or concerns about whether you or a family member may have been the victim of medical malpractice like this, please reach out to us.